Welcome everyone. I'm excited to welcome you to today's presentation. We'll be discussing scenario-based MCQs for Prometric. In this session, we'll explore how these questions are structured, what to expect, and some tips to approach them effectively. So let's get started and dive into this interesting topic together. Let's consider a scenario where a burn patient presents with a hoarse voice. This is a critical situation that requires immediate assessment. The most important thing to remember here is to check the airway first. When assessing a burn patient with signs like hoarseness, we need to prioritize airway management because burns, especially around the face or neck, can cause airway swelling or obstruction. By checking the airway first, we ensure that the patient is breathing adequately and that there's no imminent danger of airway compromise. This step is crucial because securing the airway early can prevent airway obstruction, which is life-threatening. So always remember, in any burn patient showing signs of airway difficulty, like hoarseness, stridor, or trouble breathing, your first priority is to check and secure the airway. When assessing a burn patient, one of the first signs to look for is a hoarse voice. This can be a key indicator that there's airway edema developing, which is swelling inside the airway. If the airway starts to swell, it can quickly become obstructed, making it difficult for the patient to breathe. Another critical point is that smoke inhalation can also cause airway obstruction. When someone inhales smoke, it can damage the airway lining and lead to swelling or even deposit soot and chemicals that block airflow. This is why airway compromise can happen rapidly in burn and inhalation injuries. Now, it's essential to understand that in burn emergencies, the airway is always the highest priority. Ensuring that the airway remains open and clear is fundamental before addressing other injuries. If the airway isn't secured, other treatments won't be effective because the patient won't be able to breathe properly. So, in summary, watch out for signs like a hoarse voice or signs of smoke inhalation because they tell us that the airway might be at risk. Securing and maintaining the airway is our top priority to ensure the patient's survival and to set the stage for further treatment. Let's talk about the other options and why they aren't the first priorities in this situation. First, applying dressing might seem important, but it's not the priority before securing the airway. We need to make sure the airway is protected first to prevent any further complications. Next, starting fluids is certainly important for patient stabilization, but again, only after we've ensured the airway is clear and protected. Finally, giving pain relief is essential for patient comfort, but it comes secondary to airway management. The key takeaway here is that airway protection is always the top priority, and other interventions should follow once that's secured. This approach helps us focus on the most critical aspect of patient care in emergency situations. When you encounter a burn patient showing signs like hoarseness, singed nasal hair, facial burns, or soot in the mouth or nose, it's crucial to recognize that these are clear indicators of potential airway compromise. These symptoms suggest that the airway may be swollen or obstructed, and this can rapidly become life-threatening. In such cases, we need to treat it as an airway emergency immediately. That means checking the airway without delay, assessing for any signs of obstruction or difficulty breathing. Remember, quick action can make all the difference in preventing airway obstruction and ensuring the patient can breathe effectively. This is a key nursing point because early recognition and prompt response are vital in managing burn patients with respiratory involvement. Always keep this in mind as part of your overall approach to burn care. The goal is to stay vigilant and act swiftly to secure the airway if you see these signs.